March is Brain Injury Awareness Month. It's estimated that 12 million Americans are living with an acquired brain injury, or an ABI. According to the Brain Injury Association of America, more than 3.5 million children and adults sustain an acquired brain injury each year. An ABI is an injury to the brain that's not hereditary, congenital, or degenerative. These can be caused by electric shock, oxygen deprivation, stroke, substance abuse, toxic exposure, or other means. Within acquired brain injury is another subset, traumatic brain injury, which is caused specifically by trauma to the brain by external forces. One of the dangers of a traumatic brain injury is increased risk of developing dementia. The specialists at CMI show how technology has advanced to better detect dementia in its early stages.
Investigation of dementias with nuclear medicine is one of those fields that's really taking off, because at this moment we don't have a good way of assessing someone for Alzheimer's. You want to be able to diagnose that early for the sake that they can get treated early and hopefully delay the symptoms. Nuclear medicine PET scans, metabolic brain scans, have been the primary way of inferring whether or not someone has Alzheimer's type dementia. But it's not exact. It gives us a good ballpark idea as to whether or not the patient has Alzheimer's. But the only way to know for sure if someone has Alzheimer's is a brain biopsy. So right now, nuclear medicine scan is all we have really going for us. And it has trends in the metabolism within the brain that lets us know whether or not this is likely an Alzheimer's type dementia versus other etiologies.
It really starts in imaging. It's like, what is the question? What does your physician need to know? We have a full armamentarium of imaging available to us, and that is why a radiologist has so many years of training and how to deal with all these different imaging modalities, finding out what is the best exams that need to be done that will get the information. And there are new exams that are coming out practically every few months, let alone every year, that we need to keep up with. Nuclear medicine is a little bit different in that it's not as much anatomy as it is physiology, meaning it's how does the body work. We do brain scans to see if the brain is functioning properly, so we can actually localize if there's an abnormality exactly where it is in the body without having to guess that it's approximately somewhere. We can tell you exactly where it is.
For more information on the board-certified radiologists at the Center for Medical Imaging, or to find out more about their numerous imaging procedures, please click the Brain Scan StoryLink icon on our homepage, yourhometownhealth.com.